Hi everyone, and hope everybody is happy and just finish your OPD. So let us start and learn something about homeopathy. First of all, I would like to discuss some cases. If there are no questions, no, there are no questions still. People have still not joined. So I'll just do one or two cases before I go to the questions. Now I'll just take a simple case where the patient came to me for abscess in the teeth, in the root there was abscess, and the doctor had told the patient to drain that abscess. The patient came to me, abscess formation in the root of the tooth, or you can say in the gums. It was just localized there, and the patient had this abscess before also, one or two times. So at that time he had drained the abscess once. He had done an operation, but there was no it was happening again. This was the third time the patient was suffering from abscess. Now the abscess, because of the recurrence, the abscess has gone to the bones also, and there was infection in the bones also. So the doctor told that maybe we have to drill sometimes and take that part also out. So it was a long procedure. The patient came to me and he wanted to just test for some days homeopathy. If it works, and if it does not work, then he said that I'll go for the operation. So welcome, Dr. Abhishek. The patient came to me and I gave the patient about, the remedy in 30 potency, two times a day for 5 days. I repeated the dose because I did not have the LM potency of that medicine. When the patient came off after 5 days, the swelling was subsided, the pus had already drained out with the medicine, and he was feeling much better, and the pain was also much better. So any guesses which remedy which I gave for prescription? Anybody? There are a lot of doctors online. So Dr. Dhruv, you are welcome. So this is a simple case of abscess of the root, and I gave the remedy. The patient is much better after 5 days. I repeated the 200 potency after 5 days, and in 15 days everything was resolved. The patient was back to normal. This is the first case which I wanted to discuss with you. Everybody can think of the remedy. It was a remedy prescribed on the basis of Metromedica. Next case, the patient came to me. Of course, that patient, the second case, the patient came to me where he was suffering from pain in the bones and pain in the gums, and he did not know why the pain was there and how the pain was there and what was the cause of the pain. So this was very surprising, and the patient came to me for treatment. Okay, good afternoon, Dr. Vishaka. This patient had a very classical symptom that whenever there was pain, whenever there was pain, the patient used to press his teeth. Whenever the pain, the patient used to press the teeth, and he used to find the pain was better. So this was the only symptom, because of the OPD. The patient came with this symptom, and I had only one symptom to prescribe, and the remedy I prescribed, and the patient was much better with the treatment. The pain in the gums, the pain in the teeth was treated with this one dose of medicine. I gave the patient 30, and then after a week 200 potency, and the patient was better. So two cases I have presented in front of you. One case was the abscess of the root, and a second case, a simple case of pain in the gums and pain in the teeth. The patient had taken a lot of what do you call painkillers. The patient had taken vitamin tablets. The patient had used a lot of other toothpaste and all, but the patient was not better. So we can discuss the remedies. Before that, you try to analyze the case, see what remedy I prescribed, and then we can go to the other questions. So I have a question. Sir, constant urging to urinate, please explain this rubric. See, there are in rubrics, good afternoon, Dr. Disha. In rubrics, what happens, there are two types of, now in homeopathy, there are different types of approach of rubrics also. First of all, plainly, you can say desire to urinate, and the patient passes a lot of urine. This is the first thing you can take with the literal meaning, the rubric. I have taken in my practice, and I have got good results with that. Second, urging to urinate. Okay, now if the patient is suffering, the patient tells doctor, I cannot wait for urination. Whenever I have to go to urine, I go to the urine. after that also, sometimes after sometimes I feel again I have to go for urination. First thing, rubrics this. Second thing also, the patient wants to tell you something. The patient wants to empty his mind. The patient wants to do something, but he cannot speak. He cannot speak for whatever reasons, and that's why he has that urging. Urination means passing of water and passing of, we can say, uh, waste products. So there is waste products, mental thoughts, negative thoughts, pessimistic thoughts. The patient wants to get rid of that thoughts by telling somebody. So he always wants somebody to talk to, and that's why you can take that rubric also. This is called as the implied meaning I did. But if you ask me, just take the basic rubric. Wants to urinate, you can take Cantharis, Petroselenium, Calcareca, Argentum nitricum, Gelsemium, Causticum, Equisetum, lot of remedies. Okay, I hope you understood both the basic meaning and the implied meaning. Yeah, Dr. Bharat, welcome. सर, हर चीज में पॉइजन नजर आए लगता तो मैं नजर क्या लेना चाहिए में? सी, delusion poisoned one, delusion enemy everyone is, delusion surrounded by enemy there are 3 4 and a lot of rubrics. You can take this type of rubrics, but if you ask me, I will always say try to find out why the patient is has having this type of feeling, and that's how you can correlate and then prescribe the remedy. Walaikum assalam, Dr. Bari. Sir, please suggest dietary restriction for psoriasis and vitiligo patients. For me, or basically both the disease are related to mind. Suppression, anticipation, dominance, humiliation, lot of things, that. So in this type of cases, whenever these type of cases come to me, normally I don't advise anything. Of course, in case of psoriasis, if because of some, dietary patients taking something, and because of that the itching is more, then I try to avoid, tell the patient to avoid that. But that is also individualistic. Normally, whatever you want to avoid is, I normally tell the patient, if not, then avoid brinjols and avoid basin. These are the basic 2 things in skin complaint which normally causes excessive itching. Otherwise, it depends upon patient to patient. In vitiligo, basically I don't advise anything to stop or to eat, because it is not related to the diet, it is related to mind. Of course, for a healthy treatment and for the healthy environment of the body, you have to tell to the patient to avoid junk food, to avoid Chinese, to avoid eating late night, to avoid eating tin food, to avoid eating outside food, so that the harmony of the body is maintained, and then the treatment results are much better. Both the disease come in autoimmune disorder, so good case taking, my dear friend, my dear doctor, is very important to treat this type of cases. I hope you got some input. I am 48 years, tobacco chewer, my last teeth is long during and irritating. See, if you are basically, a habit of tobacco chewing, first of all, a strict instruction, stop it. And by the time you stop it and you get some symptom, you feel that the teeth is long, it is elongated, you can have 3 or 4 remedies that are very important that comes to my mind. First is magnesium carb. I have treated one case. Causticum, chamomilla, and entimtat. Yeah. Sir, kindly tell some medicines where person don't want to do any physical or mental work as he gets extremely fatigued. Go to simple Allen's note, read Helonius, read Natrum carb, read muriatic acid, you will get your answer. Okay? Please guide about Cox Slims nosode. I have very few cases of Cox Slims nosode. 3 cases which I have in my Bombay clinic I have treated them, one with Brata carb, one with a rare prescription Huang Nang, one with conium, and the other remedies which I use normally is Calcarea carb, Sorinum, Medorinum, Rustox. मैंने सबको छोड़ दिया है, जिसको जो करना है करे. Let them do. I want to live my life. What is the rubric? See, when the patient feels that I have left everybody, I don't care what people think about me. Now you can take 2 type of rubrics. One is you can take indifference to everything. Second, indifference to life. Third thing, I have left everybody just because I was listening to everybody and people don't care. That's why I have left everybody. So the patient has become rebellious also. So you can think of the situation why that the patient land up in this type of complaints, and then select the rubrics, because in homeopathy we have a lot of rubrics which are very similar. So you can differentiate when you have the whole case in front of you or the background of the case in front of you. Okay, I hope I'm clear. If I'm clear, just give me something, thumbs up, or I know that I am clear. Otherwise I'll again try to explain you. Sir, I have suffered from musical obsession disorder. Music is repeat on my mind. You have to know why you are suffering from this problem, and then we can always go forward. And where to get this nosode? You can get most of the medicines from St. George, Mangalore. Sir, kindly tell some medicines where a person don't want to do any physical movement. I have already told you. You can refer to my other. Sir, I have suffered from musical obsession disorder. Music. See, basically, you have to understand why, and simple as that. It's obsession. You could not control it. So you can take self-control, loss of, or self-control, want of. Okay. Sir, GA, can you explain rubric generalities? Heaviness laden. I want to take this rubric. Patient feels fatigued and heaviness in the body during running, jogging. We had L4 and 5 surgery. You go to Allen's keynote. I have told you 3 or 4 medicines. You can take that. You add agaricus, Plumbum metallica, muriatic acid, phytolica, Helonius, natrum carb to that. Frustrated with family, used to, so this is very important. So the patient is basically frustrated from the family. So first of all, you have to take elements from cares and worries. The first thing you must take is elements from cares and worries, and then comes the indifference to everything. Then that if you add, you can get a beautiful rubric chart. Okay. So in homeopathy, it is very important to understand in which background the patient comes to you. For example, if I am not wrong, there are a few remedies which comes to my mind, Dr. Disha. First is Nux vomica, phosphoric acid, Staphysagrea, phosphorus, ambragracia, calcarea carb, lycopodium, picric acid, and argentum nitricum also. So this is elements from cares and worries, and now indifference has come. Okay, this is how you have to rubricate yourself. Let us go forward. Thank you, Disha. Thank you so much. So now I hope you understood how to see. Every time don't jump into rubrics, because in homeopathy there are rubrics for everything. If not, there are different repertories, and if you don't use one repertory, the rubric is spread in other repertory. So importance of rubrication is important, but in which context the patient is telling you, and how the patient is telling you, and why the patient is telling you, that is very important. Okay, so otherwise, you rubricate one thing, you get the remedy, you don't get results, you rubricate anything next time else, and then once your remedy works, then you can say that this rubric has worked. But the problem is which rubric to take when. That's why the history of the patient is important, in which context the patient is telling you a symptom. Okay, I hope I'm clear. Can you share any cured hypothyroid case in detail? I have, by the grace of God, so many cases of hypothyroid treated in my practice. Today only a patient came to me where the TSH level was 37 last month. I did not tell the patient to take allopathy medicines. I gave the homeopathy medicine, and now the report is 17. I am sure next month the report will be below 5. I think if my assistant doctors are online, they will tell you that their case taking and their remedy, and I have told the remedy, and the hypothyroid cases are much better. See, hypothyroid case comes in, endocrine disorder. It is very important, and I am lucky that my assistant doctors who are working with me they take a beautiful case. So for me, if the case is taken properly, half of the work is done. And if they are online, I think they will tell you that we have so many cases of hypothyroid treated and cured with homeopathy. Because of shortage of time, I am not able to make the cases and make the transfer, make the PPT and put the reports and then prescribe, because By the time I finish my morning OPD and have my lunch, the evening OPD starts, and that comes to 9:30 in the night. And by the time it's 9:30, I'm so tired, I go home and sleep. So I've told few of my assistant doctors to make a PPT so that I can try to share my experience of treating hypothyroid or diabetes or blood pressure or tumors or cancers, which we have cured in our OPD. And I can vouch for that because it is their case taking. The patient had come to them first time. We have prescribed the medicine and they are much better. Okay, so let us go forward. Yeah, so the assistants there are online and they have told you that we have a lot of cases. Sir, apathy is before menses, home the remedies. You know, whenever you have something before menses, just now I will tell you everything, remedies also, but my experience, once you start taking, apathy before menses, diarrhea before menses, and stress before menses, irritability before menses, you treat one, something else starts. You treat one, something else starts. So my suggestion would be just take aggravation before menses, whatever it is. It may be restlessness, anxiety, depression, diarrhea, bloating, gases. And if you then repetize like Boningosian type, that we get a lot of remedies. Like for example, calcarea carb, calcarea phos, lacasis, calicarb, lycopodium sepia, natrium rubovista, veratrum. All these medicines have symptoms aggravation before menses. Then we have remedies during menses, and then we have remedies after menses. We have remedies just at the beginning of menses. Sir, my menses came at 8 o'clock in the night. By 6:30, I started this symptom. So beginning of menses. Then hyoscyamus, calicarb, phosphorus, lacasis, calcarea phos remedy starts coming. So if you take generalized, it would be much better rather than going this. But of course, if the symptoms are very precise, very syphilitic, then you can take this type of symptom like apathy and all. So if you see the rubric, that apathy before menses or despair before menses, you have remedies like Veratrum. Very interesting remedy. You give the remedy and the patient works. Confusion before menses, sepia and semicifuga. Or you can say aversion to noise before menses. I had a case, Nux vomica. Anxiety before menses. Then you can take remedies like graphitis, ignitia, stannum, nitric acid, Nux vomica, sulfur. So there are a lot of things you can take. You can take a lot of patient is very angry, very snappish before menses. Then you can take chamomilla. So, or you can take absent-minded during menses, muriatic acid and calcarica. Lot of remedies are there. I'm sorry, I'm very fast, but this is what I can tell you. Kindly tell some medicines for severe sneezing and rain. I've told this remedy before in my behavior YouTube live. Go and check this YouTube live, okay? Patient comes to homeopathy for any alternative for contraceptive medicine. Is there any such medicines? Yeah, a lot of patients comes to me also, but I have not given any medicine because I don't know how it will work. Because see, contraception is breaking the nature cycle. So in homeopathy, everything is about nature's law. So you can't go against nature. So I don't know. I have never prescribed, and I can't tell you this answer. Okay. So let us go forward. No, absent-minded during menses is muriatic acid muroc. That's right. I hope you understood something. I was very fast, because whatever thoughts comes to my mind, I just say, because otherwise I don't get the thoughts properly. I hope you understood something before menses. Everybody, anxiety before menses, or aversion to noise, I told you. Or you can say very cheerful before menses. I had a case of depression, and the mother came and told me that my child is only happy for 3 days. I said, in which day? Whenever the menses is going to come, my child is very happy, otherwise she has depression. I repetized the case. I entered the case with this rubric. I prescribed the patient, I think fluoric acid I prescribed the patient, and fluoric acid cured the case. So this is how we treat this case. Sir, please, not remembering at the time of rhinitis. You go please and check my previous YouTube. You will get the answer, because there are so many medicines, and this is very simple question. Simple, we have a lot of other things to do. You can say cheerful before menses. A case of severe depression, only 3 days happy, fluoric acid cured the case. Sometimes, the patient says, I'm very happy, but whenever menses is going to come, I lose my confidence. The remedy is geranium mat. So these are the very good entry points if you're taking the precise symptom before menses, because it is a physiological disturbance. So then you can always treat these cases with this symptom. Can homeopathy cure IBS? Absolutely yes. I have so many cases and so many cure in my practice. I think I just presented a case of IBS of a patient of USA, where I took the case online. We sent the medicine and the patient is cured. The patient has sent us the cured video also. This patient had allergy to nuts and gradually she could not eat anything, and we cured that case. Lot of cases, of course. IBS to treat is difficult but not impossible. We can definitely cure the case. Recurrent ulcers inside my mouth since 1 year. Please tell me the solution. The solution, Dr. Pandey, is homeopathy. Okay? This is the solution. And ulcers in throat, there are so many remedies, but you have to be with precise, like ulcers bleeding, ulcers spongy, ulcers deep, ulcers deep, deep, ulcers painful, ulcers painless, lot of remedies. Generalized remedy for ulcers, if you want to write, you can write down arsenic, lac acid, nitric acid, muriatic acid, iodine, borax, Merxol, nitromur, sulfuric acid, lot of remedies. Okay, thank you. Abhi Adke, I don't know the name. Let us go forward. Today I was a bit fast. The questions are good. So always try to define. If you try to define the ulcerations, it will be much better. So it becomes easy for me to prescribe the medicines and easy for me to give the remedies also. That is very important. So let us go forward. Please suggest medicines for adenoids with symptoms of recurrent corazon. Dr. Wasim Bhai, this also, I have told so many times in my life. Please refer to my previous videos if you can. If you don't get, then I'll tell next time. Itching in the thighs worst in night. This is a very interesting question, Itching in the thighs, a so precise question. So see, normally itching in the thighs would be related to fungus or ringworm. This also I have made my videos, but I would just tell the remedy to you. Teucrium marum verum, azatic indica, echinacea, sulfur, graphitis, nitric acid, basilinum, lot of remedies. Importance after taking allopathy medicine. Avoid allopathy medicines, avoid antidepressants. Antidepressants, it is a normal side effect of any antidepressant. Try to stop the medicine, take the case and give the remedy, it would work. Otherwise, you have remedies like whatever antidepressant he is taking, you can have in homeopathy potency, you can give and the patient is better. You can give allosocratin or naxonic also. Gynecomastia medicines, very interesting case. I had a case of gynecomastia. The patient is much better. If I remember, I had prescribed the patient on constitutional medicine, I think pulsatilla, and the patient is much better with that. Okay. Hi sir, please say remedy for something sticking sensation in submental area after taking tofu. Submental. So this. Now, whenever the patient is suffering from a sensation that he has feeling that something is stuck up. So there are 3 or 4 remedies which I find very useful in my practice, but try to get the deeper aspect of the patient, why the patient is having this type of sensation. If you go to the mathematics, go to the remedy, there are no precise medicine for this type of symptom that something is stuck up here. If at all, you can take a sensation as if the patient feels as if fixed ideas, fixed thought, it is there, it is there, it is there, it is there, fixed ideas, and then you can go and prescribe. You can think about thuja, syphilinum, medorinum and nitric acid. Okay? Are you with me? Hello everyone, are you with me? Yeah, don't get frustrated, Dr. Sahab, Ishan, don't get frustrated. Take some medicines which I have told you and then repetize, go for the thermals and then you can get the remedies. Yeah, let us go forward. Hello, are you with me? Thank you so much. Hello, are you with me? Or I'm very fast today. Because there are so many questions, sometimes I am very sorry that I cannot answer everything. So so ulcers I was telling you, there are a lot of defining symptoms of ulcer which I have told so if you try to define your ulcers, if it has become chronic and you have taken a lot of medicines, so what happens, the character, the consistency and the symptoms of ulcer don't come, and you're only left with some symptom of ulcer. In that case, you can take the rubric ulceration, mouth, chronic, and then you can see. Then you can go to the repertory chart, then go for the thermals, go for the thirst, and one of your remedies, character of ulcer, and then you can prescribe. Okay. Oh my God, you have taken everything but no results. So you have to write some case symptom, and then you can think about there is a symptom in the repertory where it is written ulcer, and then you have to think where the ulcer is there exactly, in the gums, the teeth, on the cheek, and then you can go to the repertory and try to find out the remedy. So let us go forward. So stick sensation, Dr. Malar, I hope you understood something about that, fixed ideas. In homeopathy, first try to differentiate why the patient is telling you this type of symptom. Then go for symptoms and then go for the rubric. It is said immediately, as suddenly you jump into the rubrics, you can't get the remedy right. That's why it is very, very important to first analyze the case, analyze the symptom, ask the patient why, and then go to the remedy. Okay, don't jump into the remedies. So let us go forward. We have still 2 or 3 minutes left. So yeah, so I was just telling you about the remedies. Rightly said. I told you the 2 cases, but I did not get any remedy, any answers from that. One was abscess in the root, and one and you did not give me the remedy. And second, I only forget what I asked. So one was abscess in the root. Yeah, my assistant telling sir there's one question. So one was abscess in the root, and the second was pain in the teeth, and there was a lot of clinching with the patient was better. I have ulcer in colon with IBS since last, to Ayurvedic home with LPD Bandur. Yeah, so Prajwal, I can understand, IBS with ulcers are very, very difficult to cure. I also have, some cases where I am not able to give results. I have also failures, but believe me, homeopathy has a very good result in treating IBS or ulcerative colitis or Crohn's disease. Again, go to the doctor or change the doctor. Maybe he is not able to get the symptoms or cannot repertorize your case properly. Go to a doctor, give a good case taking. I think you will be definitely get relief with your IBS. खाना के बाद पेट का फूल जाना और वॉक करने से सांस फूलना. Looking inside, see, this is a very, very common symptom. Bloating of abdomen after eating. You can think about carbo-veg, leptandra, iriswar, nux vomica, sulfur. Lot of remedy, doctor. I think it is chronic ulcer mein padya. So you have to take the whole case. So 2 symptoms which I told you just before the start of the webinar. Abscess of the root, I gave the remedy that was Hekla lava. Hekla lava. Today go home and read Hekla lava, a very interesting remedy. Abscess of the root, with infection going directly inside the teeth with a lot of pain. I prescribed Hekla lava. The patient is much, much better. And the second symptom which I told you, that the patient is, whenever there's pain in the gums and teeth and lot of what you call gum boil, the patient tries to clinch it together like this, and the patient feels much better by doing that. The remedy which I prescribed for this was Phytoleca decantra. Hello, are you with me? Phytoleca decantra, and the patient was much, much better with that medicine. 200 potency. Okay, so nobody, I think, even tried to answer the question. At least when I ask something, you also try to answer, because that's how we learn. If you learn, I also learn something, and whenever you get results, whatever I have told you, please do share this, so that I also feel happy that every week I come in front of you and we talk, so that everybody basically gains. I also learn and you also learn. So whenever you get results with whatever I have shared my knowledge, do write on the comment box. So this were the 2 remedies. Hekla lava. So tell me one solution, sir, at least. Okay, so as simple as that. If you have taken all the medicines and you're still not getting relief, the ulcers in the mouth have become chronic, I'll give you 2 remedies that you should think about. The first is arsenic alb. you basically start with the low potency. Just make sure how are the ulcers and how is the mortality. Better by cold or better by warm. Better by warm would be arsenic alb, and better by cold, which I have found good results with natrum mur. In LM potency repetition, you should feel much better. Sir, childhood to the promoted, all of them lost their voice, brain tumor. Yeah. So in Amdarji, this is a very chronic case, So you have to get the whole case with me, so then I can give you results. So it is already half an hour up, and thank you everybody. Thank you for joining. I hope you enjoy as much as I enjoy sharing my knowledge with you. Until next Saturday, goodbye.